Okay, so here we are, Facebook live event number 2. Today is October the 3rd, and so welcome. So I hope you guys are all enjoying the posts that I've been writing on my Facebook page as well as the Facebook groups, and feel free to share it with your other friends, colleagues, other med students who are also looking to pursue U.S. residency training. And most importantly, let me know if there are any comments or any questions or clarifications that I need to make. And let's try to keep this as interactive as possible, as a place where um, you can drop your questions and that I can answer. And what I've been doing it since the last live event. There were a couple of questions that were asked. One was about tell me about your weaknesses and strengths. So I've kind of made a rough draft of that, and it should be out hopefully this weekend or early Monday. I should have that out. And there's going to be my next few posts will be about what a program director is looking for in a residency applicant. Whether is it the scores, is it the letters of recommendation, is it networking, personal communication, the personal statement. So I've kind of talked about about the data that's out there from a survey conducted by NRMP. So that should be out on Friday, Saturday, and Sunday. I've had to, because it was a big post, I had to break it up into 3 separate posts. And again, feel free to check out uh, the parent website, ed4medus, ed4med, us.com, where you can kind of figure out the various services uh, that I've been offering to medical graduates, either the online practice interviews or consultation services for um, medical graduates who are looking to apply maybe next year period. Um, and at this time of the year, almost everyone who is applying for this year has already turned in their application, but that's another thing that I do help with at ed4medus.com. And because this is the first year that I've been doing this, I've purposely kept the pricing to be very easy and not hurt your pocket. I know as medical graduates, either U.S. medical graduates or international medical graduates, you're already pretty concerned about all the expenses that you're making and have to make. So I've tried my best not to overburden you that way. And I'm kind of doing this more uh, to help out other medical graduates. I'm not really doing it for the money because I already have a full-time job. So I'm kind of doing this more um, as a way to kind of help other medical graduates do their very best on interview day. And because besides the USMLE scores, a lot of how medical graduates end up in a residency program has to do with presentation. How are they writing their filling out their ERAS application forms? How are they um, filling out, or how are they writing their personal statements? How are they interacting with the with the coordinators? Are they polite? Are they very aggressive? Are they very pushy? And how are your interview skills? And so it's these other things besides the scores that at least now play a very important role in how likely you are to successfully match into a U.S. residency program, because a lot of people are scoring high, and so you need to have these other ways of showing how your application stands out from the crowd and is different. Whether it's maybe your personal statement, whether it's your uh, any research experience. The last two posts you would have seen about how some medical graduates have done research before applying for residency, and have also um, found out, have also practiced now how to present their research experience to a faculty member and at the interview, and also to answer any follow-up questions. Okay, let's see if someone is online right now. Oh, let's see. Okay. All right, so we're still waiting for some to join in. And the other thing about research, which I'll kind of write maybe in the next few posts, a lot of questions come to me about what's the best strategy for building research experience before submitting a residency application. And that is a difficult question because it really, really needs a lot of planning and a lot of um, organizing, various parts of the research. So I'll talk, or I'll rather write about the different kinds of research that can be possibly completed, or at least moved to a stage where you can talk about it at your interview. It doesn't really make sense for you just to do maybe 2 or 3 days of not sorry 2 or 3 months of research just doing data entry, and then that data just sits there and is analyzed maybe a year later. That's not really research experience. So research experience is more like case reports, case or case series. Now that is getting very difficult to publish. The case reports, the journals are just inundated with so many case reports, and I think a case report is good for at least presenting locally. For example, if you're observing at a hospital, and during the time that you are observing, if you come across an interesting case that you want to work with the attending and write it up, that'll be you can at least write it up and present it either at the rest. Sometimes the residents have their own research weeks or research months, and at the end of, if it's towards the end of the year, certainly they do have like a research day where they everyone presents their research findings. You can try to at least present it locally. For example, if it's internal medicine, every state has its own, it's called ACP, American College of Physicians chapter, state chapter, and so that's where most of the residents also present case reports. Like I said, it's very difficult to get case reports published, just because there's so many journals doing this, and because there are so many case reports also out there. Case series also, it kind of is very similar, and while you can present it again locally, I really don't think you can. You can have it published in a high impact journal or so. So if we look at what are the possible research projects or studies that you can do before applying for residency, then the few that it's mainly the surveys, patient surveys, or surveys of physicians or medical students or nurses, whatever, or that you can do, and that is something that I really feel is there is some need to understand why the research is being done, the how the survey gets designed and implemented, and the results analyzed. So that makes for a very good demonstration of all the scientific methods. Now, of course, when you're doing a survey, then it does the survey. There are issues. Again, journals take kind of accept surveys, only those surveys that have a very high, it's called a response rate. That is, if you reached out 100 patients, and if only 10 responded back, so that's a response rate of 10%, then it's very unlikely that any journal or anyone will listen to your survey results. So there are some challenges of doing survey, but I think if you have a good mentor and if you have a very solid question that you want to research, it could be anything. It could be even things like surveying the patients as to how long did they wait in the waiting area, or if they understood, if they have understanding of whether they have things like chronic kidney disease, and or what is their GFR. Like in the last post, I talked about how the applicant tried to survey patients about their knowledge of A1C. So that's research survey. I really think is something that is feasible, that can be done, and at least you can get to the point of having enough data that you can present and discuss at at the interview. And it happens quickly. It happens maybe 2-3 months of data collection and of solid data collection, and you'll have enough data to present and discuss at the interviews. The last category of research that make sure everyone can see this. Okay. Feel free to join and question. Ask a question. So the next category is retrospective chart review. That's kind of the only one really that you can finish. I don't want to say quickly, but in a reasonable amount of time. And the one good thing about doing a research survey or a retrospective chart review is this whole thing called IRB approval. So for any research to be done, there has to be something called IRB approval, where there's every hospital, every university and institution, they have an IRB, institutional review board, that kind of makes sure that the research that is being done is not going to harm the patients. And so getting that approval takes time. And so these kind of studies, like a retrospective chart review or patient surveys or physician surveys, they are either exempt or the approval or the review process is expedited. So very quickly you can get an approval and start the research. If it's going to be an interventional study where you're testing a study drug or testing the effect of an intervention, that just takes months and months, and you won't have, it's very likely you will not have anything available to you by the time of residency. So unless you're truly done with all your exams and just waiting for a year or so, that might be the only time where doing a major study or major clinical trial would be helpful. So these are the four real really feasible research opportunities: case reports, case series, um, patient surveys, or any survey questionnaires, and retrospective chart reviews. Now, some may also ask about writing a review paper or it's called a meta-analysis. Now, about a meta-analysis, almost everyone doesn't like, no one really likes the meta-analysis, because even after you put in all the information from all the different trials, at the end of every meta-analysis paper, there's just one conclusion, that more research needs to be done, and that's it, and nothing. It doesn't serve any other purpose. So I kind of don't really encourage meta-analysis unless that's kind of the only thing that's available to you. And then there's writing a review paper, which I think is a good strategy, especially if you're able to collaborate with a researcher who is very well known in the field. And what I can do the next time is maybe show you how to find these experts on PubMed. That's kind of the website where all the publications are listed. And what happens is that you need to have a very clearly defined question, a very narrow question, and try to find the researcher who is writing about, who is publishing articles on that topic, and then try to collaborate with them. Tell them, hey, I have an interest in such a topic, and I really would like an opportunity to write a review paper. If you notice that, if you look on PubMed, you will find that there are some authors that are just repeatedly asked to write review papers on the topic that they're an expert in, and I'm sure at some time they just get tired with. Yeah, if there's someone live, yeah, please join in and write down your questions. So again, if with the review paper, I think that's a good strategy to try and get someone's attention, especially if you have some experience, some prior research, or you've written something about it. Try to find a researcher, maybe if maybe who is situated where you're staying. So, for example, if you're in Atlanta and you find a researcher who's interested in maybe in hypertension or something, and if there's a very specific topic that you like, it'll be very easy for you to collaborate with that researcher. They really, I don't really think they, kind of a researcher really minds you being the first author on the review paper, as long as they are the last author. That's all that matters for them. This way, I think you can build a good relation with a researcher, and of course, get letters of support. But of course, you have to be very, uh, you have to really show that you deserve that letter. So you have to like meet the deadlines, show them that you're doing you're making progress, writing the review paper, and of course, you learn a lot this way, and maybe that's one way of how you can um, even if for example again in that example, if you're in Atlanta and if you reach out to this researcher, after you've built some relation, you might ask them that, hey, can I observe you in the clinic or so and so, and that might be another way of you know networking and getting both clinical experience as well as research experience. So so the review paper, again, journals kind of don't really, a lot of journals are getting a lot of requests or a lot of submissions that are review papers. But that's why it's important that you have a researcher who is well established, because um, a journal would certainly like to get a review paper from that researcher if they're very well established in the field. And other things you could do is, so if you do find uh, if you're in a place where there is a academic medical center, a university hospital, a lot of the faculty who does the research, they also write textbook chapters. That's another place where you can work with them. I mean, the researchers are very busy. They have a lot of things going on, and they really wouldn't, like I explained it, they really would not mind that you be the first author, either in a textbook chapter or whatever, um, while they work um, on their like research grant or funding, and but at the same time are able to build their resume by collaborating with you. I think that's like a win-win situation for both you as the applicant, as the applicant, and for them as a researcher. Um, what else can I tell you about research? Um, Now, for example, when we talked about the patient survey or the retrospective chart review, make sure you're at least able to get to the point where you have completed the analysis and have some data to share. At least try to have that when you're going for the interviews. Again, in the last post, for example, the applicant who I kind of interviewed, this was one of those online practice interviews. And, so while he was explaining his research in diabetes, he kind of showed me that paper with that pie chart and the bar graphs, just to kind of, because some of us are, understand things much better if we see it ourselves. So at least if, it'll be very nice if you have the data to discuss at the interview, rather than, all right, I finished the data collection and someone is analyzing it. That's not very impressive at all. But at least if you have pushed to the point of finishing the data collection, analyzing, and have some preliminary study results that you plan to, submit as an abstract to a conference, or for either an oral presentation or a poster. That'll really be very nice, and it will really show that you're one of those very few people who can who can move the project forward and can have the study to a point of completion. A lot of research gets done, it gets dropped in the middle. People lose interest, people lose motivation, and the study doesn't get completed as planned. So so it's very nice to for a residency program to find an applicant who has done who has some kind of a research experience and is able to get it and is able to complete it, or you know, or move it forward to the point of completion. Okay. Any other? Let's see. Any other questions? Well, and you know, if you have some or if you have some like an abstract or a poster that you have already presented or plan to present, you can also bring that up and show it to the interviewer. Another thing you could do is, if your research is very much preliminary, um, you know, certainly when you're applying for residency, um, you should certainly mention that, hey, you're doing the research, and then over the next few months, you know, before the NRMP match, the deadline to submit the rank order list, you can keep the program director and your interviewers updated about, okay, you know, the study that I discussed with you is now accepted for, you know, poster presentation or for oral presentation at so and so conference, and that'll be very nice. That'll be a so this way, you know, the interviewer is going to remember you, and again, it gives them it gives you as an applicant a lot of credibility that you know, you took the effort and the pain to again move the research forward and update the interviewers. So so that goes very well, and you know, that's one strategy on how you can use your research experience to improve your chances of getting getting an interview and getting ranked. And you know, the word research sometimes gets misleading. You know, whenever we think of research, we think of randomized clinical trials, but just like how I explained, it's almost impossible for someone to do a clinical trial and have the results by the interview season. It's and it takes many years. So I would say don't even bother about it. Just focus on case report, case series, patient surveys, physician surveys. What else did I mention? Retrospective chart reviews, review paper, maybe meta-analysis, but that's all. Those are all the options. And the good thing with maybe a review paper or a meta-analysis is that you can do that remotely. So, you know, if again, if you have a certain topic of interest where you want to write a review paper, but the expert is located somewhere else, I still think it's you know, I still think it's good to still reach out to this researcher, collaborate, and write the paper. And I'm sure, you know, a few phone calls can kind of overcome this whole issue of, you know, not being physically there close to the researcher. Or, you know, nowadays with the Skype and everything, it's very easy to do the video chatting and make a relation with the researcher that way. But again, you know, choose a topic, a very narrow topic that is of interest to you, because only if it is interest to you, then you will move the project forward, and you will do the appropriate, you know, literature search and everything, and also do the writing. The writing does take a lot of time and a lot of patience, a lot of perseverance, but you will get there. You know, certainly if you're very interested and motivated to write the paper, and that's again a very good thing to show to the interviewer when you're going for the interview, or mail it to them as the interview season gets to a close. And certainly before the NRMP match rank order list deadline, you should really let your program directors know that hey, this is where my review paper is. This is the stage where it is right now. And I myself did that when I had uh, some studies and review papers, more when I was applying for my fellowship. And um, I think it even helped me get like a late interviews, maybe sometime like January or so, just because I updated the program directors about where my research, uh, what stage my research efforts were at. And so think about it. And we're running out of time. It's 12:31. Thank you for those watching. Didn't really have any questions today, looks like, but I'm happy to talk with you all, or answer any questions uh, in the comment section, or feel free to send me a message through the Facebook Messenger. All right. Thank you very much. All the best. Bye now.